Kira Frew. I'm a physiotherapist at Creekside Health. I grew up in Vancouver. We were weekenders from the time I was a little kid, so I spent a lot of time and weekends and holidays in Whistler. And during school, I actually did a placement in Squamish, and I loved living and working in the Sea to Sky. So I figured as soon as I was done school, I'd look for a job in the Sea to Sky corridor, and an opportunity came up in Whistler, so I pounced on that. I mean, I love being in the mountains. That's definitely a fave of mine. The people are great. The energy's great. It kind of always feels like you're on a holiday. Yeah, so it's just a great place to both work and play. I started being interested in physio as a career option when I was in high school. So I was always participating in a lot of sports and ended up having my first injury late in high school. Ended up seeing a physio for an ankle sprain and started being intrigued by the profession. And then from high school, I went and did a degree at UBC, an undergraduate degree in human kinetics. And that kind of started me on that path more officially. The stuff I found most interesting was probably, like, I did enjoy a lot of the exercise-based classes through my undergrad degree. And then I also went and, before I went to physio school, I pursued a master's degree in injury prevention. I would say I incorporate injury prevention into my practice, in that I like to look at patients in a holistic way and try to dive down to the root cause of injuries that have happened. And within that, and once I've kind of found those causes, try to treat and educate around them to prevent injuries from happening again. Like, I really like looking at and understanding my patients as a whole person to understand what their goals are, kind of understand what direction to approach them from as far as communicating with them, what treatments might work well with them, and how to motivate them if they need any. We're fortunate that most people in the Sea to Sky are pretty self-motivated. So many people are active with their job choices and their activities. So just important to kind of understand those to help best understand how to work with people well to get the best outcomes. Understanding people here is sometimes understanding how to, I don't want to say negotiate with them, but how to pull them back a little bit, or sort of understand like what they're willing to give up or rest for, and when they're just going to get back into it. So trying to educate them and work around that and make sure that they have the best information to go forward so that they're least at risk of re-injury. So the treatment techniques that I like to use are some soft tissue work, so hands-on therapy, joint mobilizations. I do dry needling, which uses acupuncture needles to release trigger points in tight muscles. And then I'll use taping or bracing when needed. And then I like to make sure that I include some exercise prescription in every treatment session. So I like including exercises in every treatment session as well, to make sure that somebody has stuff that they can go home with to manage their injury. I've treated a lot of people pre and post surgery. So prepping someone for surgery is just making sure they have as much range of motion, as much strength going into surgery as they can, to optimize their outcomes afterwards. And then after surgery, I've worked with the orthopedic surgeons in the Sea to Sky area for 6 years, and that's working with the orthos collaboratively to sometimes follow specific protocols depending on the injuries, and to take them through the process of recovering from more severe injuries. Surgeries often take a lot longer to recover from, so they involve a lot more physio sessions and physio management than some other injuries might. Yeah, I think the most rewarding part would be helping people with the more serious injuries that have prolonged recovery. So, something like ACL surgery, we unfortunately see a lot of those, and those have quite a long recovery. So it's pretty rewarding being a part of that and kind of building a therapeutic relationship with the patients, and just helping them get through every aspect of their recovery and back to work or play. Yeah. Nagging injuries, yeah. I think a common issue that leads to nagging injuries is that a lot of people don't rehab to 100%. And so that might be that, they've gotten back on their bike and they're able to ride, and their knee or their ankle or their wrist might flare up just a little bit, but they can ride. So they're like, it's fine. I don't need to go to physio anymore. And that can just, if they haven't built that full strength back, or their full range of motion, or they're not loading properly, not only is there a risk of re-injuring that area, you're probably compensating and loading somewhere else improperly. So I think it definitely puts some increased risk at other injuries too, or other aches and pains, when we don't rehab to 100%. And having an injury, like something like just simple, like an ankle sprain. So an ankle sprain is a really good example of an injury where one of the greatest risk factors for re-injury is just the history of an ankle sprain. So you obviously can't avoid having that risk factor, but what you can do is rehab it to 100% to kind of mitigate or try to reduce the impact of that on any future risk of re-injury. It's hard to say how often we say that. I think what happens a lot and what we see is that we'll see it in the younger population where they won't come in as much, or they'll self-discharge themselves because they recover well. When you're in your early 20s or in your teens, it's like you heal fast, you heal well. And what happens though is that as people get a bit older, those things start to show up, and we'll be treating people in their late 20s, early 30s, and they'll have an injury, but they'll also mention, but I had this ankle injury that I never really did anything about, or this knee injury that I saw physio once for. So it's not, they might not show up right away where you get an injury or a re-injury, but it's often that things show up down the road, and people are like, I wish I'd rehab that a little bit better when I was younger. Yeah, so some of my favorite self-management tools for at home are foam rollers, lacrosse balls, the little peanut style lacrosse balls as well, which are good for doing self-release along the spine. And then bands are really helpful, so elastic resistance bands. And so I often will get patients set up with those for their strengthening exercises in their rehab process. If you're interested in booking an appointment for a new or existing injury, check out the website at creeksidehealth.ca.